Ladies and gentlemen, welcome back to the Muscle Intelligence Podcast. I'm your host, Ben Pakulski. Another incredible podcast coming at you today in the realm of testosterone and overall hormone optimization. We went to the top of the totem pole in the world, head of the International Hormone Society. Dr. Thierry Hertoghe joined me today to dive into everything hormone optimization. Gents, ladies, this is a deep dive when it comes to testosterone, growth hormone, thyroid, and other hormones that ultimately directly impact the way you look. Dr. Hertoghe does an incredible job about talking about the physical features that start to change and start to manifest with the diminishing levels of these hormones. And we've all heard of testosterone, growth hormone, and thyroid, and oxytocin. There's other hormones that you may not have heard of that are directly implicated in not only how you look, but how you feel and how you perform. We all want to look, feel, and perform at our best at any age. And understanding how hormones are implicated in this is incredibly powerful as far as a tool for you to start to understand, well, what should I be doing? What should I be considering? And ultimately, what's healthy, what's safe, and what's not? And so we went to the head of the International Hormone Society, Dr. Hertoghe, to get to the bottom of all of the data. And this man is incredibly up to date, incredibly well-versed in all the most recent data, as well as having over 30 years of clinical practice and 3 generations of familial practice. So Dr. Hertoghe has literally been in the medical world for a very long time, his entire life. And he's dedicated, and for a man in his 60s, looks absolutely phenomenal, incredible shape. So he's not only talking the talk, but he's walking the walk. Today's podcast is really a deep dive into best practices for testosterone replacement therapy, how specific hormone deficiencies show up in the body, and precisely how they affect the aging process. We talk about a framework for the proper use of estrogen blockers and whether or not we should use them at all is a very controversial topic. So listen up. Clarity around human growth hormone and ultimately cancer. So that was one question I have for Dr. Hertoghe, because we hear some rumblings around growth hormone potentially driving cancer proliferation, which he will tell you the answer in this podcast. The opportunity to lower cholesterol without statins and ultimately via hormone therapy, and how to balance your hormones for optimal levels. Remember, hormones, gents and ladies, is not about a single hormone in isolation being optimized. It's about balance, learning how to balance all of the different hormones, and ultimately the ones that are going to be most important to pay attention to as we age. Dr. Hertoghe currently serves as the president of the International Hormone Society. As I've mentioned, he practices medicine that focuses on longevity and reversing of the aging process. So just to keep this zero cost to consumer information flowing to you, gentlemen, ladies, I would appreciate it if you do get some value to this podcast, that you share with at least one person you know and love to continue to grow the message of intelligent muscle building around the world. Ultimately, intelligent optimization of humans is what we're after here. I want to support you in being the best version of yourself. And whether that's with your energy, with your vocation, with your family, whatever matters to you most, Muscle Intelligence is here to support the physical version of yourself and the mental version of yourself to show up with the highest and best version of you. Enjoy the podcast with Dr. Thierry Hertoghe. Dr. Thierry Hertoghe, the world expert on hormone replacement, ultimately developing a movement for healthy aging and longevity around the world using hormones and nutritional therapies. Incredibly grateful for you joining me. Thank you, sir.
Thank you, Ben, for inviting me. I'm very honored to speak to your public of people age 40 plus and want to perform better, who really want to get out of life the most they can.
Yeah. And so we have a lot of men, we have a lot of women listening as well. But hormone optimization is, in my experience, there's a lot of noise. There's a lot of misinformation. There's a lot of information being thrown around. And so I thought, who better to bring on than the head of the World Hormone Society to the show to really just kind of sift through it all. You're someone who's been doing this for 37 years, taught at, I think you said 192 different conferences, and I'm sure more. And I've probably consumed 100 plus hours of your content over the last 10 years. Just because like when anyone says, who's the best guy in the world when it comes to hormones, it's always your name coming up. So I definitely am excited to kind of dig in.
Thank you. It's quite flattering. Just to say you that I started being interested in hormone therapy by family. So it's 4 generations in our family since 1892 that we treat with hormones. It started with thyroid therapy, and my father, who was the 3rd generation, added the adrenal hormones and some of the sex hormones. But when I came, then I added other hormones, and it's all, I can tell you, fascinating. Even for me at my age now, I remain fascinated.
Yeah, and that's another thing that speaks to the credibility. Because I mean, for your age, you look just truly incredible. And I always look for you have this incredible way of explaining hormone deficiencies. You're like, oh, if a person's hair is flat, it's testosterone. If their face is doing this, it's this. And I was like, gosh, he's obviously got such a in-depth understanding of that. I love actually to start there because like some men are sitting at home, they're because one of the things we experience in the world, as you'll know, is these reference ranges on labs tend to be very wavering country to country, even year to year, they seem to change. And some men are like, I feel pretty good. How do we actually start to know when is a good time to start replacing hormones?
Well, globally, I would say age 30 would be a good age. Women, for example, have at age 30, there's studies showing that they already have a decline of the female hormones. So you don't need to treat these women for a lack of female hormones till when they get menopause. That's much too late. That's like a disaster. You can start earlier. DHEA, for example, it's a hormone of the adrenal glands above the kidneys, has a lot of effects, but not as strong as testosterone and others. But that hormone declines also at age 30 by loss of pubic hair and armpit hair. And so growth hormone is a tremendous hormone that has a lot of effects, but it already declines at that age. So I would say at age 30, 35, those are the ages you should start doing it. But even if you come at age 50, well, there's still a lot that can be done. You've not lost so much, but it's very important to start early because you feel better. You have more energy.
And someone who's in really good shape, a lot of my audience is like, our life, one of our highest values is health and fitness and longevity. And we train every day and we do cardiovascular endurance every day. And we're in great, body composition. Would you still say someone, after 30, they're still going to see a decline?
Yes, they will certainly see a decline, and it will accelerate because they're doing an excessive amount of sports. So if they don't supply that, they will get more deficient. Many people are always surprised when they look at me. They say, look, we know a lot of people who run a lot. I like to run marathons, but they are wrinkled at your age. But they have very good legs, very strong muscles there. But all the hormones that are concentrated in the legs and not in the whole body. And the topic is that every part of your body is in good health and looks good. And your audience is probably many men, but you also have women. You said, I believe more women when they say I feel good than men, because men are very courteous, they're brave, and they don't admit having problems. And if they have problems, they look at positively and they go over it. But then the body still shows signs that something's wrong. And I think it's better to listen to your body and respect it and take good care of it. And that's one of the ways, is to supply the hormones that are deficient.
Yeah, you have an incredible video that I recall. I probably watched a few years ago now, where you just go through all these facial features and be like, oh, if your upper lip is starting to wrinkle, it's this deficiency. And if your eyebrows are starting to, I would love to have you go through some of that stuff. Obviously, my hairline's a little bit faded or a little bit receded, but I'd love to have you talk about what are those kind of expressed characteristics that people are starting to experience that indicate hormone deficiencies.
Yes, that's possible. I have a whole presentation on that. I don't know if it's possible to include it here easily in this podcast.
So I'll link to it in the show notes, but if you just want to give us a couple like highlight examples, you see somebody walk in, you're like, okay, this person's deficient in that.
Yes. So if I see even somebody from far away, I can already spot a lot of good information to help to know what I should do. If the person comes in, has a bowed back, and that is tensed, looks prematurely aged for his age, it's probably growth hormone deficiency. So, and if the face is very pale, you can see that even on distance. And when the person comes closer, the eyes don't shine. That's a lack of testosterone in men and lack of estrogens in women. And we know then that these women will be improved with the treatment that we would give. So it is fascinating for me I can almost know the degree or of intensity of the lack of hormones that this person has and what can be done for correction. Let's give some examples. For example, maybe your hair loss is too much long ago, but usually men lose their hair not because they have an excess of testosterone, but because they have a deficiency in testosterone with an excess proportionally of another hormone called dihydrotestosterone, the one that gives you body hair growth, bird growth, etc. And by this, and this is reversible if you come at least at the beginning of the stage or after 10 years, but if it's after 30 years, more difficult, then the men don't mind. They're used to their lack of hair loss. But we really get here. I even had one of my patients who got the right treatment, but also received a hormone gel with testosterone and with blockers of the conversion of testosterone, dehydrotestosterone. And he started to put here some of this cream, and the hair got back there. Then he put the cream a bit further, the hair got back also. And then he put it there, and he got almost totally his hair back this way. Took much time, like a year and a half, 2 years. But it was really surprising. If we go down the face, for example, if there are deep wrinkles here on the forehead, that's usually a decrease in growth hormone. And growth hormone is a hormone that builds up your body, gives you much more muscles, less fat, and makes you, I would say, much more intelligent and with a lot of inner peace. It's often the hormone of the big boss, the one who doesn't panic when there's a fire. He says, you'll do this. And he has such an inner peace that he's able to do that. And when you look at the eyebrows, if there's a thinning of the inner eyebrows, for example, that's typical for a lack of testosterone. And so this is improved with treatment. And if the middle eyebrow is really lacking, that's often a decrease of growth hormone or IGF-1, two main hormones. That's the two most important hormones to rejuvenate your body, but also your mind and your brain. And if the outer third of the eyebrow is missing, that's a lack of thyroid hormone. So when you supply these hormones, it comes back. However, it is very important to note that hormones work in association. So if you give one hormone and not the others, the person is deficient, you might aggravate the deficiency and that hormone might not work. For example, the inner eyebrow, the outer eyebrow only grows when you give thyroid hormones to an adult plus growth hormone. You need the two, otherwise it doesn't. But it does grow back. I have much more eyebrows since I took growth hormone at age 38. So it was 7 years too late for taking it. But anyways, better late than never. So it helped. So there's a lot of things that can be done to improve the physical aging. But when you do it outside of the body, on the skin, and it also happens inside. There are studies that you see with growth hormone that growth hormone reverses atherosclerosis. And the persons feel better. The biggest effect of hormone therapy is the performance. They can perform better professionally. I'm not afraid of a patient who takes growth hormone. That patient will get more income anyway because they're brighter, they have more resistance, they need to sleep less, they see better their priorities. So actually, it's very interesting how the aging can reverse. We cannot do everything now because maybe a lack of knowledge or a lack of hormones or other products, but we can do a lot. I think you can rejuvenate from 5 to 15 years, and in some cases, even 20 years physically. And that's really, really a good thing.
Yeah. And so I think some of the concern that I hear, like it sounds like, supplemental growth hormone is a great idea. Some of the concerns over here, and I know you refuted this in some of your webinars, and people say, is it not going to accelerate cancer growth? Because I think there was one study at some point, and you talk about that on one of your webinars.
Well, I try to have a review of all the literature on the topic. When you look at studies, when you give growth hormone to adults, it decreases the risk of cancer by about 50% in people with severe growth hormone deficiency. Now, these people with severe growth hormone deficiency have, on the average, twice as more risk of getting cancer and 4 times the risk of dying from cancer. So they are cancer prone because of their severe growth hormone deficiency. Like at 10% of what you need, they have that. And that's insufficient. When you supply the growth hormone, they actually decrease by 50% those risks of cancer and of cancer mortality. So you almost normalize the situation. So it's improved. What is true is that in laboratory, you can make cancer cells grow better with growth hormone or IGF-1. However, in the body, we have also an immune system, and the growth hormone stimulates the immune system on almost any level. So the global balance is positive. Growth hormone improves survival of the person also, and decrease the cancer risk. I think that's almost a sure phenomenon. So the problem we have in science and in journalists is that they report always a fraction of what happens, and that could raise anxiety. I think it's in the United States that the newspaper that would only give good news couldn't sell at the end. In the beginning, yes, and couldn't sell. So people need to have dramatic things, make them fearful, but that's not how life is. Life is really very reassuring when you give, I would say, an average dose. You don't need to give an excessive dose. You give the dose that is personalized to the person. You rather get disease-free or less risk of disease than more disease. So I think it's very reassuring.
So speaking of dose, I'd love to have you, is there a range that you prescribe, or is it just, hey, you got to test and get them in a specific range? How exactly do you figure that out?
It's both. I don't base my final decision on a lab test. A lab test gives you, is a passage of hormones in blood, for example, or in the urines, but it's not the final effect in the cells of the hormone. So you need to do lab tests and check that passage, and the levels should be at least average of the hormone, average compared to young adults, because the levels decrease with age and the reference ranges change. And then you need to do a good physical examination, and it's quite complete. We do many patients that come to me and I said, I've never had such a physical examination, so much different details seen and screened. And we also have an extensive questionnaire that gives us all aspects. So we almost know what type of complaints they have. Growth hormone deficiency, vasopressin deficiency, melatonin deficiency, testosterone deficiency, thyroid cortisol deficiency, or excess. And that's really interesting. So a doctor needs to do a whole assessment and not just focus on lab tests, because that's just a part of the person. And that doesn't always give all the information.
I know within the US anyways, and some parts of the world, peptides are becoming very popular now. Have you experimented with peptide, maybe growth hormone precursors and secretagogues to complement
I was even one of the first to experiment with it. And so I give a lot of lectures in those American conferences about it, and it's really worthwhile. For example, follistatin is a hormone you can take, quite expensive, but that increases your muscle mass quite a lot. So it's really something that has to also be given to patients. The problem we have in countries, because I work with many countries, is that it's not available in pharmacies in most countries. And when it's not available in pharmacies, doctors get into problems if they prescribe them. So it's just a pity. And I had some investigations against me, but without big problems. But I mean, it's hard to get, because what you get normally now is mostly on websites where you don't have a quality control or pharmaceutical grade control. So that's more difficult for doctor. He cannot prescribe it then, but he can talk about it in his patient and give information on it. But it's really worth, I think, among the best of those peptides is follistatin for muscle growth, for the skin tan, melatonin 1 and melatonin 2 for sexuality. It's much more potent than Viagra or testosterone to increase sexuality. And so there are several of those that are really worthwhile. And then the most important hormone to reverse aging is IGF-1, insulin-like growth factor 1. It's made in the liver mostly through stimulation by growth hormone. And that hormone is very difficult to get, so you can get it easier as a long-acting IGF-1 or R3 called. So it's the same molecule, but it has an addition of number of atoms extra, so it stays longer in blood. And that one is among those that help the most.
Yeah. So speaking of follistatin, have you experienced or heard of there's this recent boom in follistatin gene therapy? There's a lot of very high level people doing it. And I'm a little bit cautious because I suspect there's potentially downside to turning these genes on. Because I understand obviously when I say gene therapy.
Yeah, I understand. Well, let's say you could do that with chemicals that don't belong to the body, or you could do it with hormones. When you do with hormones, you do unrepress some genes and repress other genes. So we already have gene therapy with hormone therapy. Mm. Now, where it turns around is mostly on gene therapy also that would activate telomerase. Telomerase is sort of enzyme that makes that the chromosomes don't shorten anymore, but lengthen more, and at least the endings. and that may keep the cell young. And there's some controversies that it may cause cancer, but nobody ever found that it could cause cancer in humans. There's even, I think, more than a study on more than 500 patients with cancer taking a telomerase activator called TA65. And actually, they said it's an unofficial study, so you have to be careful. It's the firm that paid for it. But they say there was no increased risk of cancer. It was the patients on the contrary felt better, had more energy. So again, it's difficult to give a good evaluation of that, but never base your decision on fear that this and this can happen. Try to see what are the positive effects, what are negative effects, and then feel what the right decision is. I don't believe we should base any medical decision on fear, but mostly a balance of the information. And then there probably is, for some genes, not so much risk to unrepress them by those gene therapies, but it's still future. It's not something done a lot. There's this Paris, for example, in America, who has been injecting through I think a virus vector substance that stimulates the genes of the telomerase to lengthen. And I think she does well. She's doing well. And I think much of the science and the progress has been obtained because some courageous researchers tried it on themselves.
Yeah. As far as growth hormone, I'm coming back to that and dosing. Is that something you suggest every day or 5 days a week, or like have you done it consistently since you were 38, or do you tend to cycle it on and off?
No, I do it consistently, and I try not to miss a day. And if I miss it 2 days, I'm sure I have to sleep 2 hours more. And one day I would say 1 hour more. So I feel very quickly the difference. It's a treatment you really need to take every day, and that does not damage the gland. On the contrary, it spares your gland, doesn't have to work so hard anymore, or still like 30% less, but it will keep on much longer throughout the years and the decades. A study I've shown, for example, with thyroid hormones, when you give thyroid hormones to people who have a thyroid deficiency, you stop the treatment. After 3 weeks, all the lab tests are similar to what it was before in 9 patients on 10. And that is surprising because in 20 years, there's a decline of about 10-15% of the hormones, and they don't have those declines. So it spares the gland. There was also a study in rats, male rats, that were very young, and they give them incredibly high dose of testosterone, overdosing. So we're probably quite muscular, those rats. And they stopped the treatment at when they were old, and very surprisingly, they had a testicular volume and a sperma production the same as young adult rats, and they had the same testosterone levels as the young rats, while they had taken treatments that suppressed actually the secretion of testosterone because it was so high, suppressed the secretion of testosterone testicles. So it really spares the gland. I don't propose to overdose. I always propose to give the right dose for that person that corrects the deficiency and doesn't put the person in excess. And that's probably even a better treatment for long-term use.
Yeah. So just wrapping up growth hormone, at nighttime administration or morning, do you have a preference?
No, it has to be taken in the evening in, let's say, 98% of the patients, because it's a hormone that induces sleep, lowers the cortisol, and so you sleep better and restore. And you probably also have more receptors at night. Because in reality, in a normal person, natural process, most of the growth hormone secreted the first 3 hours of the night. So you mimic the nighttime peak. What would happen if you would take it in the morning? Well, it will decrease the cortisol by 30% on average. And so you'll have actually less energy this way. So it's normally not a good method. Now, growth hormone has the particularity also it stimulates the thyroid function. So some people, that's the 2% people, may need rather tolerate better the growth hormone in the morning because it stimulates their thyroid function, and at night they would not sleep so well. They have a sort of paradoxical reaction. But that's very tiny minority. So I would really propose to take it when you have the most receptors for growth hormone on the cells, and that's at night, to take then the growth hormone, and you mimic the nature.
Makes sense. So I've discovered in myself, you wouldn't know this, I was a professional bodybuilder for a long time. And I took growth hormone, and not a crazy dose, just high dose, just like 6 IUs a day was probably my peak. But what I found is even if I take growth hormone now, my body doesn't actually convert it into IGF-1. So I'm almost always chronically low in IGF-1. Would this be an instance where you'd suggest IGF-1 supplementation?
Yeah, after age 50, most patients do not produce enough IGF-1 when they take growth hormone. That's on average. But you could have people at age 40, at age 35. So most of my patients, on average, above age 50, systematically have the two hormones, growth hormone and IGF-1. And we mix it even in the same vial, and it seems to work better when you put them together. I don't know why, but that's what we see. They inject it because it's injectable before bedtime at night, and it works well. And on average, it's 50% of one, 50% of the other. These two hormones have actually different effects. So you really need that to keep your looks and to feel good.
Interesting. Is IGF-1 available pharmaceutically in Belgium? Because I don't think it's available in North America in general.
You can normally get it in all pharmacies throughout the world for children. Okay, because that's if they cannot grow with growth hormone, they grow with IGF-1. And the firm that sells the official IGF-1, the bioidentical, doesn't want to sell it for adults. So we can get it from Belgium, from Germany, etc. When their stock is excessive, then they're ready to sell it. So it's a little hard to get throughout the world. But you can get easier the long-acting IGF-1 with synthetic derivative, which seems to work. But the problem, it doesn't have any study on humans. It only has animal studies and a small fraction. If you have 500 studies, let's say I checked the double-blind placebo-controlled studies. So there were about, I think, 200, or 130 with IGF-1. When you have none of them with the long-acting IGF-1 on humans. But it does work. I tried it myself, and it does work almost as good. And the ratio is that the IGF-1, long-acting IGF-1, the R3, 1 milligram of that is as potent as 10 milligrams of the bioidentical IGF-1. Maybe I'm exaggerating, maybe just 5 times more potent. But anyway, it's more potent, so you need less. And you get that in powder. You have to always add what is called bacteriostatic water. Never mix it only with sterile water. It has to be, of course, sterile, but there must be a preservative in it for it to hold in the fridge longer. Otherwise, you have to inject everything the same day.
Yeah, and these are readily available on like peptide websites, but I always doubt the legitimacy there, especially of a molecule like IGF-1, which I believe, you could tell me if I'm wrong, is relatively unstable as far as once it's,
Well, surprisingly, I find that the long-acting IGF-1 works well in most patients. You cannot check it in the lab test because it doesn't go on the test. The test cannot detect it, but you do see people getting thicker muscles with it, etc. So it does work. It does give you power. It's really a hormone that gives you have might. But there are in peptide websites, Melatan 1 and 2 works well. What doesn't work well so easily is follistatin. So you need to be maybe more careful with follistatin and others on peptide website. And then those growth hormone stimulators are interesting. They can work, but does not work so well. And that's a very important hormone for in the COVID. It was the first hormone that showed that you could decrease mortality by 3 times by giving it. Was thymosin alpha-1. That doesn't seem to work in most peptides websites, probably because it's a too long molecule and more stable. But it's true, you really point to think, when you buy it in the pharmacy, you're almost sure it's stable. You're sure about the stability. And that's not sure on a peptide website.
Yeah. One of the most fascinating webinars I saw you put out recently, I don't know if it was recently, was talking about hormonal regulation of cholesterol. And I thought that was very interesting, and how you specifically spoke about the benefits of thyroid hormone in cholesterol, because I think there's a lot of people who are just confused about cholesterol, even the negative potential effects of cholesterol, if there is some, and obviously people have very elevated cholesterol. So if you wouldn't mind talking about your approach to managing elevated cholesterol with hormones.
Yeah. Well, first of all, you need to know that half of the outer layer of your cells, of all your cells, is cholesterol. So it mustn't be such a bad substance. And that many of your hormones, sex hormones, adrenal hormones, are made of cholesterol. So you need cholesterol. You may not have too low cholesterol. However, cholesterol is a substance to make sex hormones and adrenal hormones. And when that process doesn't happen well anymore, there's the enzymes are getting deficient, they're not working well, they're in too small quantity, you start piling up cholesterol because you have hormone deficiencies. And what is also interesting is these hormone deficiencies will increase further the cholesterol. And on average, when you are thyroid deficient, for example, your cholesterol is 20 to 40% higher, can go up to 50% higher. So you really have a big difference. And if you're lacking testosterone, it's about 20% or 50% higher that cholesterol can cup. We lack female hormones also. So you really need these hormones to be good. Growth hormone also decreases cholesterol. So what we do here in our clinic is we give a sort of multiple hormone treatment, which is correcting all the major deficiencies a patient has. And then we see that the cholesterol is down and they don't need statins. Most of them don't need statins anymore. It does take a time, like 8 months, to really stabilize to the lowest level possible. But it's relatively quick, actually, in a human lifetime. And it's really interesting to do that. It's a much safer way of reducing the cholesterol. And what is probably dangerous is not the cholesterol itself, because the average level of people in autopsy who had a lot of atherosclerosis, the most severe form of atherosclerosis, aging of the arteries, that those people have on the average a level of 178 milligrams per deciliter. And that's about the average in young adults or in middle-aged adults. So if you have a high cholesterol, it doesn't mean you have a lot of atherosclerosis. But if you have a lot of oxidated cholesterol, you check that, there's a test to check that, then it's not so good and you need to improve that. And you improve that by antioxidant vitamins, but also by the antioxidant hormones. Many of them are antioxidants.
Yeah, I'd love to have you speak about that. Is there specific ones to prevent the oxidation of cholesterol?
Yeah, so for example, DHA is an antioxidant, but not at high doses. So you need to keep the doses physiological. Thyroid hormones increase antioxidant enzymes. For example, glutathione peroxidase is a protecting enzymes that decreases the free radicals, so increase oxidative stress. And that is also works as an antioxidant. Growth hormone also decreases the free radicals quite a lot, by 30 to 40% in children who have severe growth hormone deficiency. So it's really very exciting. And then one of the most antioxidant is estradiol. That also can be antioxidant. What you need, testosterone, not so much, and not so much progesterone, but for example, melatonin is greatest antioxidant. It is has also something special that you don't have with nutrients. It can go everywhere in the body. It can go in the fat-soluble phase, and it can penetrate the water-soluble phase. So it's water-soluble and fat-soluble. And there it can exert its potent antioxidant effects. And melatonin is very safe. So if you have a disease, you might have to increase quite a lot the dose, and it can help to decrease very strongly stroke or heart attacks and things like that. So really,
that's something you personally take daily, and you suggest most people be taking melatonin?
Yeah, I'm taking melatonin. I am taking a dose that is very little because I don't need more, otherwise I sleep less well. I take 0.1 milligrams sublingual, but I've had with the vaccine of the COVID, I had a stroke.
Oh, wow.
Difficulty of talking, yes. That vaccine wasn't good for me. And I think I recovered so well, so easily, because I took very high dose of melatonin at that time for 4 to 6 months. And so you can use it in disease, you tolerate much more, and it works.
Wow, I didn't know that. I'm glad to hear you're so well recovered. That's incredible.
Yes, well, I'm glad. It took 2 years. I had heart insufficiency and things like that. But one of the reasons was also that I didn't increase my hormones, because what the vaccine of the COVID does, or having the COVID does, it damages your endocrine glands. And I didn't increase my cortisol that I was deficient in. I didn't increase my testosterone that I was also deficient in, and the thyroid hormones. I was maybe groggy, I don't know. But basically, when I corrected those, I was much better. So you really have a lot of people down there who have a post-COVID syndrome or post-vaccine COVID syndrome, and they need to get their hormones checked and improved.
If I recall correctly, when I was watching your thyroid webinar on cholesterol, you suggested using desiccated thyroid, not T3 or T4. Is that correct?
Yes. So desiccated thyroid has much more than in a normal preparation. It has the T4, which normal preparations have, thyroxine, and it has the active hormone, the most active, 10 times more active than T4, 3 to 10 times more active, T3. And it has T2, T1, T0. T2 has been shown to have cardiovascular effects, so you get more with it, and you make it more natural because the thyroid secretes all these hormones. You get also some calcitonin in it, and it's attached. All these thyroid hormones are attached on a bigger molecule called thyroglobulin. So when you take a desiccated thyroid, this powder of thyroid gland of pork generally, you take it. You have mostly thyroglobulin, and the thyroglobulin is a big protein that's difficult to digest, takes time, and so you have a slow release of all those hormones. And then you can have a 24-hour coverage that is good. The classical thyroxine, for example, is not well absorbed. It varies between 37 to 67 absorption on average. So depending on what you eat, on how when you take it. So you really have to take it on the stomach. That's already better. But it's not, it doesn't give as well good results as you can have with preparation with T4 and T3 or desiccated thyroid. For me, the best already. That's people really are much better with it. They testify. If they took thyroxine before, most of them are better. I did a study that I published, and 89 on the 91 patients who were on the thyroxine diagnosed by other doctors, when they switch over to the T3 and T4 preparation, they were better. All the symptoms decreased. They had less complaints. They felt better.
Yeah. Do you ever prescribe estrogen or estrogen blockers for men?
Yes, I take myself an estrogen blocker. I take, it's called anastrozole, our brand name is Arimidex, because otherwise I have too much estrogens. The problem is that I like to work with products where you have enough scientific studies. So you're sure also about the bad effects. And with the the natural estrogen blockers like DIM, or indole 6-carbinol, you don't have much studies, but I think it's relatively safe. However, it works very efficiently with Arimidex or anastrozole to decrease. I take a very small dose, and that prevents me from having too much estrogens. Because if you have too much estrogens, what are the consequences? The consequences for a man is when he has too much female hormones, his prostate enlarges with fibrous tissue. So you get prostate hypertrophy, benign prostate hypertrophy. And you can have also easier heart problems, myocardial infarction. You can also have decreased libido and also decreased erections because receptors for estrogens are very similar to receptors for testosterone. So it blocks a bit the action of testosterone. You can also get breast formation. So it's not good to have too high levels of estrogen. And that's really the problem in many of the bodybuilders, for example, is that they don't check enough that, and they can then get enlargement of the breast or prostate hypertrophy. So, but many, I think, professional bodybuilders know probably more about that, and they are more careful. But you still need to know that. Don't take testosterone without checking your female hormone levels. And if estradiol levels are high, you probably need a blocker. Now, it must be said that the number one causes of high estradiol in men is coffee drinking and alcohol drinking. One glass of alcohol increases in one study, Greek study, increased by on average 60% the estradiol levels. 2 cups of coffee, 60% increase also of estradiol levels. So,
and body fat's got to be up there too, right? Excessive body fat's got to be up there for increasing estradiol.
Also, and then when you have more body fat, the fat tissue has an enzyme to convert testosterone to estradiol. So as a spiral, you aggravate the problem.
Yeah. When you say high estrogen, when someone has high estrogen, they should be taking an aromatase inhibitor. How high?
Well, let's say, what is the optimal level first? It seems that when you take all the studies together, the optimal level in men of estradiol is 24 picograms per ml, and the reference range is, let's say, between 10 and 45. So you're in the middle and rather a little bit lower than that. If you have lower levels, there's an increased mortality and there's more osteoporosis. If you have, so osteoporosis is loss of calcium in the bones. And if you have higher levels, you get this prostate hypertrophy and gynecomastia, the breast formation, etc. So you really better be around the 24, 25 picograms per ml.
Have you heard of any research on potential negative effects to the vascular system with aromatase inhibitors, specifically the drug, anastrozole, causing any issues to the microcapillary network?
I'm not so familiar with that, but if it is so, it is probably because it's overdosed. One of the problems, I pay a lot of attention on capillaries because when people don't improve on one place of their body, it's because the capillaries are not open. So I like to open up the capillaries. So if you give too much aromatics, what you do is you block the conversion of testosterone to estradiol too much. And it is not testosterone, but estradiol that gives the dilatation of the capillaries and the arteries. So testosterone has to convert to estradiol to give vasodilatation. If a man gets red in the face by taking too much testosterone, it's because he has also a lot of conversion of testosterone to estradiol. And if you block that, you block, of course, blood perfusion. And that's not good for the capillaries.
So you said specifically you want to pay attention to the capillary's ability to vasodilate. Is there anything else on top of estrogen that you would suggest in that realm? Because I know that's a big concern for guys. One, erectile function, but also just cardiovascular function.
There's a lot I can say. I'm a follower of the Doctor of Lenin. Long time ago, the Doctor of Lenin, I don't know his name anymore, Simonov or something like this with an S. He saw that people didn't improve with a pathology, with a disease, the heart or whatever. So what he did, he put those people in warm and cold baths, very warm, very cold baths, ice bath. And then he changed them all the time, like every 2 minutes. And by doing that, he opened all the capillaries and they improved. Without hormones, without nutrients, without a food change or whatever. That was surprising. And this is, I even did that for an Alzheimer patient. So we gave him hormones around the eyes and we injected growth hormone around the eyes, and he had warm and cold towels around him 2 times a day for 1 minute and a half each towel. And with alternation, it was surprising. He really improved a lot. He actually could read a newspaper again. He could even drive a truck in a small truck in the city, which he wasn't able. And when I came, he couldn't even go to the toilet alone. He didn't know his name. He couldn't talk anymore. And that was reversed. And part of it is because we open all the capillaries by warm and cold temperature. So that's one of the ways that work. And many hormones in the body do that. I have a model on cardiovascular disease and hormones. And it shows that almost every hormone can open up the capillaries and can increase the capillary growth. So there will be more capillaries around the organs. So they work very deeply. And the most important one is probably thyroid therapy. But testosterone is also a very potent hormone to open up the capillaries and to develop them, to have more capillaries.
You said you injected hormones and gave hormones around the eyes. So is there a local benefit to injecting? I'm not sure what hormones you're putting around the eyes, but if I were to inject, growth hormone to a specific area, does there seem to be local benefit?
Yes, there's a local benefit. You rejuvenate the face. You can also have less wrinkles or tighter skin. And actually, this is what I did initially. I did by mesotherapy. Mesotherapy is all small little injections around the eyes and on the face, etc., for rejuvenation. And I do it around the eyes because the eyesight is improved this way for 3 weeks to 9 months. Depends on the patient. If the patient takes a good treatment inside, has good food. And you have, so when you inject around the eyes, you really improve the eyesight, whatever it is. We even tried with, maybe not cataract, but certainly other types of myopia, presbyopia. Presbyopia is not being able to read easily. You generally see 1 to 2 lines lower. You have some papers that show smaller and smaller prints, and then you can see smaller prints within 15 minutes after.
That's specifically rejecting growth hormone.
Well, in the preparation, there's growth hormone, there's IGF-1, that with IGF-1, it holds much longer. And there is also vasodilators. I have published a book on reversing physical aging, a textbook, and it's very practical textbook. So you have all the formulas and all the doses you should do and what you can do to improve the eyesight. And it's by doing that, when we do a double session, 2 times more products in the face, below and above, people get, during 6 weeks, feel much better and are much more intelligent. And this is why I applied this treatment also to this patient who had Alzheimer's. Right. But of course, it's an anecdotal case, so you can never promise it will work on others, but it may show, at least in one person, that the effects were very, very potent.
Yeah. Is there anything you've ever found to reverse coronary calcium?
Coronary calcium?
Yep.
Yeah. Not really. You can have more calcium deposits in the coronary arteries. That's the arteries that give blood to the heart. When you have a lack of vitamin K, adding vitamin K may have positive effects. There's also a theory that changes now. Before, it was thought that when you had calcium, it was bad, but it seems now to be considered that it might be a good reaction. It preserves the arteries to have no leaks. And so it might be a sort of protective action. But I'm not familiar with many treatments that can reverse coronary calcium, but there are several treatments that can reverse coronary atherosclerosis, the aging of the arteries. That's a thickening of the inner wall. And that's growth hormone, for example. I think there are 8 studies showing with growth hormone that you reverse this atherosclerosis significantly. There's 1 or 2 studies with estrogens, and there is, I'm not sure, there might be a testosterone study on it, but I'm not 100% sure about that. But so there are studies where we can reverse atherosclerosis, which normally leads to coronary calcium.
Fascinating. Gosh, so many things. Now, one thing that you brought up that I remember you speaking about in one of your webinars that was fascinating is vasopressin. I know you give vasopressin specifically to do with some of the, I don't know anything about the hormone, if I'm being honest, but I'm curious what it's used for and what symptom you're treating with that.
Yeah, so it has, let's say, 2 major effects. First, not the most important, but it is an important effect. If you take it in the beginning of the day, you'll normally have a better memory throughout the day because it's a memory-enhancing hormone. However, you cannot have the natural one. The natural works better. I knew a professor who worked a lot on vasopressin, and that professor, he said the natural vasopressin works even better for the memory than the desmopressin you find in the pharmacy. Now, so it enhances your short and long-term memory. Now, and you will capture more of the day. Now, if you it is also the major, and that's its most important effect, the major hormone to keep water in the body. So what you see when people age, starts at age 40, they have little lines on their face, very small lines, and the skin looks like an orange peel. Like, when you look at an orange peel, it's not very regular. That's a lack of water in the skin. And so when you provide desmopressin, and I do it by sublingual tablets, or I take oral tablets that you need to swallow, but I ask the patients to chew on it and to put it on the tongue, and all those little rainbows unfold. You also have, as another sign of vasopressin deficiency, sunken eyes in the orbits. So they're deeper, and they get less deep when you have more water in the body, thanks to vasopressin, or desmopressin is the one that we are giving, the synthetic derivative. Another sign is that with age, people have to go to the bathroom much more, and they urinate large volumes. And so they don't know what happens, and they think they drink too much water, so they drink less water, but they continue on urinating a lot. And that's a lack of vasopressin. So if you take desmopressin, you arrange it. I had one of my patients who was a very top person in finances. He wrote on his newsletter that I said, I was so better with what I'm so much better with Dr. Hertoghe gives is this desmopressin that really changed my life. Otherwise, I had to go to the bathroom every hour, and that's finished now.
And do you think that would be a good intervention for sleep for people who are waking up constantly throughout the night?
Well, certainly if those who wake up to go to the bathroom. So you need not to go to the bathroom just once a day or maximum twice at night. So yes, it really helps them to help better. Some people don't sleep well because they have to go to the bathroom, urinate large volumes. I put the focus on large volumes because if you don't have vasopressin deficiency, can get infection that makes you go to the toilet often, but then it's very small volume. But when it's large volumes with not much color, there's generally vasopressin deficiency.
Great information. Thank you. So moving on to the big one that, I think we want to understand at depth is testosterone. And I know you've got some incredible insights into testosterone replacement, specifically starting with men. And you said, you're a believer or an advocate of people after 30 starting testosterone replacement. Is that just true across the board? You assume most people after the age of 30 are going to start to deteriorate?
Yes, I think so. And certainly those who do a lot of sports because they consume their testosterone by overconsumption. And some studies show that when you do sports, the testosterone levels goes up, but it's a false picture. It's because they have less water in the blood. They are dehydrated. And if you ask another value in blood, not only testosterone, but SHBG, that's the protein that transports in blood the testosterone, that protein is high when you're dehydrated. So, and then it keeps the testosterone in blood, doesn't go in the cells. So it's a false picture. In general, you really have a decrease of testosterone up to 20 to 50% after doing intensive sports. And I like to practice intensive sports, so I correct my testosterone levels. And also, if you do sex, if a patient has sex the night before he does a blood test, the testosterone levels will generally be low. So I ask people not to have any physical activity, including sex the night before, just to have a baseline test of testosterone that is reliable.
And so if someone is deficient, actually, if we could talk about ranges, what I've noticed, and you've been around this game a long time, the range seems to drop. Every 5 to 10 years, the reference range seems to be getting lower and lower.
So what is a reference range first? A reference range is not a health value. If you're within the value, in, out, or below, or whatever, that's doesn't say if you're healthy or not. A reference range is a statistical range. 95% of patients, not of healthy patients that go to the lab, are between those ranges. And 2.5% below, 2.5% above. So if you have a low value, it's probably not so good. But if you have a borderline low value, you're already deficient in general. Many studies have come out now and showed that at that level of testosterone, there's disease. And all those levels of the disease, they usually are in the lower half of the reference range, within the reference range, within what is also called the normal range. So you're not healthy. The lower you are in that range, the worse it is. Now, testosterone is a little bit more difficult, and growth hormone is the same, or when the test of IGF-1 is the same, is that these are what are called hormones that build you up. So if you have a big body with a lot of muscles, you have to have a high testosterone within the reference range. If you're a small person with a thin body with not much muscles, a good testosterone level or a good IGF-1 level or growth hormone level is in maybe in the lower 30% of the reference range. So it depends on the spirit. So the doctor has to have some competence to recognize the relationship of the body build of his patient with what is called anabolic hormones. People who are strong and big need more. And so that's one of the things. So what is the optimal level? If you have an average size, average body build, the optimal level is on average the level in the average of a reference range of young adults. All the older age category reference range are actually not, they give their reference ranges of that category, but they are not healthy ranges. Sometimes if you're in that range as an older person, it's already much too low for you. They are not reliable. So I always check and always interpret the results of a patient I have, whatever his age, except young children, that's different. I compared to the age category 20 to 30 years of reference range, and that has to be half. But even if it's lower than half, then it's generally not good for an average-sized person. It's already too low.
As far as administration, I believe you still like transdermal creams?
Yeah, there's the two most used treatment I have is transdermal creams. And once a person gets 65, on average, it's usually injections, roughly. But I have younger patients at age 40 that already are on injections because it's the only way where they feel good and they do good on it. So it's still a range per person, but I like the transdermals a lot. However, there are not many good transdermals. If you buy in the pharmacy, it's 1 or 2%. It's much too low. It's for pubers, young pubers, and not for real men, I would say. So for real men, you need a 10% concentration. You need a compounding pharmacy that does it. And we use compounding pharmacies in Germany also because in Belgium, we're the only country in the world where there's a crazy law that forbids to get testosterone more than 2.5%. That get it from abroad. That's completely legal. But the pharmacy here may not sell a higher dose once.
And so daily administration, applied on the testicles or applied where specifically?
Yeah. Well, the best place, the more convenient and where it works well is to apply on the face. The face has, when you're shy, you get red, you have more blood vessels, but you may not curdle the bird because otherwise it converts too much to dehydrotestosterone, then you get scalding hair loss. So you apply it here in several layers, here on the sides of the neck, above the collarbone. Hopefully there's no body hair, and if there's too much, you can put it here. But I put several layers per day on myself. 3 or 4 layers different, because each time I put a new layer, it will penetrate more. And you may never put a thick layer when you put a transdermal. Otherwise, you will keep some whitish cream on it and it will not penetrate. It's better, very thin layer, and then to apply it very well in. And when it's applied, you do another layer and so on. And you do it in the morning, mostly. You can do it twice a day if you have to take high amounts. But most important is the morning. You always take a hormone before you need to use its effects, its beneficial effects. Testosterone gives you energy, gives you masculinity. It makes you to be determined. And so it's better to give it in the morning. It also helps you to do better physical activities, etc.
And for men who are doing injections, is that daily, once a week, 3 times a week? How do you like to administer that?
Well, that depends. Most of the patients, they don't want to do it often. And then they have a high level during 5 days and then it drops later on and then sometimes not enough. So most patients get 1 injection of testosterone enanthate or cypionate. Those are the best ones. 250 milligrams on average every 10 or 14 days. If you do a lot of sports, 10 days. Sometimes it's even per week. Some men are more dedicated. They want to have stable levels. And then they take it every 2 days, a small dose, a false fraction, and they spread the fraction overall. And that's maybe even a better treatment. But however, most patients, most men feel already so good with the 1 injection every 10 to 14 days that they are not wanting more. I sometimes give in people who are not compliant, who don't want to bother, an injection of testosterone indecanoate, 1,000 milligrams, once every 2 months, not every 3 months. That's never good. What the pharmaceutical company proposes every 3 months is insufficient. They have done 1 month where they're deficient. It lasts in most patients only 2 months maximum.
What's the half-life on decanoate? Is it that long? Is it 30 days plus?
I think it's less, but it's still, they claim that it's stable all over. So they would claim a half-life of 2 months or 3 months. But in reality, probably because I have active patients, so they consume more, it doesn't work more than after 6 weeks to 8 weeks, you have to give a new injection.
Yeah. Are you seeing bigger estrogen side effects like that too? I would suspect with both the weekly and the monthly or bi-monthly administrations, you're getting better or bigger estrogen rebounds?
It depends on the fat tissue of the patient generally, and if he drinks coffee or alcohol, or he puts, those Italian underwear that is so tight, smashes the testicles against the body, and then there's no good blood perfusion. When the testicles are too tight in the trousers or in the underwear, they produce more estrogens, less testosterone. So it depends on other factors also. But it's true that there's a slightly higher likelihood to get more estrogens with those testosterone injections, also even testosterone and so you need to be careful for that.
Yeah, with this recent explosion of longevity medicine, longevity focus, do you have any concern or comments around balancing anabolism? Obviously, with testosterone and growth hormone and IGF-1, we're pushing anabolic pathways. Do you have any consideration around taking things like rapamycin or anything that's ultimately going to drive AMPK pathways, or is it just, hey, you just think these hormones are ubiquitously great for everyone?
So the rapamycin is a product that makes your blood more fluid, and that actually blocks mTOR pathways. It mimics what you have with intermittent fasting. If you eat twice a day close to each other, you lose weight easier, you feel healthier, and that's intermittent fasting. So it mimics without doing the effort. When you give the doses to certain mice species or rat species, they live longer with it, but they are in worse health. They're not so good. But of course, the doses that they take are relatively high, and the doses that are proposed to prevent blood clotting in humans are between 25 and 20 milligrams a day, and sometimes even more, 40 milligrams. People who take rapamycin and say have good effects, I have some patients who are taking it too because they know other doctors. They take doses up to 6 milligrams a week, and they slowly increase. So probably by this very cautious process, it's okay, but not if you go on the high doses that you give to patients who have blood clot problems. And so I think it's in small doses might be okay, and might be too much imbalance. I don't know what effects it has on hormones. What I'm careful is that everybody gets adequate levels of hormones in balance. And when I give too much of one hormone, some other hormones are in balance. So it's very important that we keep good balance of hormones. And so people just take one hormone are often imbalancing their system, just thyroid hormones, just testosterone. They have advantages, they have benefits, but they also have side effects of less good balances. You don't give a lot of testosterone, for example. Let's take you were a professional bodybuilder. And many of those professional bodybuilders have taken enormous doses of testosterone or anabolic steroids, derivatives of testosterone. And in a certain sense, when you give a small dose, it's okay because it stimulates your thyroid function by stimulating the conversion of pro-hormone T4 directly into active hormone T3. But when you give too much, you get enormous muscle mass and organ excess. And then the thyroid hormones cannot be more produced. They are activated, but they cannot be more produced. At a certain time, there's a shift. And then there's less testosterone. There's thyroid hormone in all those muscles. There's enough testosterone or anabolic steroid. And then you see a lot of those very enormous bodybuild with muscles. They get slower, and they seem to be slow thinking. That can be due to low thyroid function. So you always need to balance. If you have a bigger body with more muscles, you need to take more growth hormone, more thyroid hormones, probably more cortisol, more DHEA, etc. So you really more melatonin because the body's just bigger. And genetically, the body's not made to make so many hormones. So
that makes a lot of sense, actually. I think that's why bodybuilders can become chemists. You just figure out, like, I need to take more of everything.
Yes. I think I would say if you really want to be a good bodybuilder and that you need to be informed on all the important hormones so that your body is better. It's not just partly better and partly suffering more.
Yeah, when it comes to optimization of health and longevity and physical appearance, is there any hormones that we've missed that we think we should cover that are vital?
Well, one of the most important hormones is so important that if you don't have it, both of us are dead tomorrow. It's cortisol. Cortisol, many people think cortisol is bad. It's used for severe disease, but it's bad for a normal person. I take cortisol since the age of 24 years, and I have energy with it. I have stamina. I can resist to stress, and I inflame less. Otherwise, I would be more inflamed, and I'm more positive. So cortisol is the main hormone when a person has adrenal deficiency, adrenal burnout. The main hormone is missing. Any person who has a burnout, severe, and keeps on, is because the cortisol is too low. That's the main hormone deficiency. So you need to have cortisol for energy, and that's also a hormone that is less decreased with time. At least what the cortisol that goes in the cells is less. And when you give this hormone, one of the major, I would say, bad consequences that happens, but physicians give it alone. But cortisol is a hormone for the adrenal glands that makes 44 other hormones. And so if you give cortisol, you need to give the major other adrenal hormones, such as DHEA. DHEA is the protector. If you take cortisol, you always have to take an equivalent dose of DHEA. If you take, and then there's also aldosterone that is very important for blood pressure. So people with low blood pressure need also to take aldosterone, or its synthetic derivative called fludrocortisone. That's very important hormone. And it makes a whole difference. It can give a person his or her life back. If you have a low cortisol, you suffer all the time. Everything's misery, and you see everything negative. You're also paranoid. You think that people will like you, and then you will hit back and sing. And you accuse them of especially the people you love the most, you accuse them more. So I really propose that this is also very major treatment. And there are other treatments. You have pregnenolone, for example, is a memory hormone, but people who take it have to take it in the morning, or their memory is not improved. Again, if you want to have a better short-term memory, you take pregnenolone in the morning, because that's also decreases in production quite quickly with aging, and when it works well if you take it in the morning. There's so many other hormones that can be used. I also work a lot with nutrients. For example, many people take sleeping pills, but do you know that there are at least, I think, 3 studies that show that when you take benzodiazepines 100 days or more a year, you have 2 to 5 times more likelihood of dying. That's lack of lifespan of 4 to 20 years. You have more cancer, 30% more cancer on the average. You have more Alzheimer's, more risk of Alzheimer's disease. So why not take things that work better? So how do you improve sleep? In most people, how do we do it? We we give small dose of melatonin to fall asleep. And at the same time, we give a precursor of melatonin called 5-HTP, 5-hydroxytryptophan, or we give tryptophan, and they convert 4 hours later into melatonin. So you can sleep the 4 last hours of the sleep also. So if you have sleep problems in the first 4 hours and problems to fall asleep, you take melatonin and small doses sublingual that works better than oral. And then you can take a precursor at the same bedtime that 4 hours later will work as sleeping pill. Also, we add GABA, for example. That's the main neurotransmitter that calms you down. But you have to be careful. Some people get depressed when they get it after a few days. If I take it more than 3 days, the 4th day I will be depressed. So, but it calms you down, it relaxes you, you sleep throughout the night quite well with GABA. So you can take it occasionally. When I do a jet lag, when I have a jet lag, I generally don't suffer from the jet lag. I sleep at least 6 good hours, but it's because I add GABA, and I take certainly melatonin and a precursor in high, to melatonin in higher amounts then.
Right, and then maybe your cortisol in the morning to kick you up?
Yes, also.
What dose is that, if you don't mind?
The dose I'm actually taking is a little higher than average dose for a man. It's 35 milligrams. During many years, I took 30 milligrams, but lower doses, I don't do well with it. And I don't get swollen face with it and things like that because it's the dose I need. You need to know that only about, I think it's 47% of the cortisol that you take by mouth, the natural cortisol, I'm not talking about synthetic derivative here. The natural 40% is absorbed, not more. 47 or 43, I'm not sure anymore about, but very small fraction, actually, it's not even 50%. And so when I take 35 milligrams, what I'm really taking is something like 15 to 70 milligrams. And the average production per day in a man is about 30 milligrams a day. So I'm adding half of that quantity, which I'm lacking. So it's not so much. And I do take more. If I would run a marathon, for example, then I would probably double the dose with a double dose DHA that day. So I have the energy throughout the marathon.
Amazing. Dr. Hertoghe, this is so incredibly valuable. You give us a deep dive into everything. And I want to refer everyone listening back to your website, hertoghe.eu, which we will link to in the show notes. So much value there and today. So thank you, sir, for being here. Is there anywhere you want to send people other than just to your website?
Yes. So we also have a clinic here in Brussels where we have a lot of American patients and all over the world. So you also can get treatment. We also can get internet consultation by Zoom. But then if you're in the States, you need to have another doctor in the States that can make the prescriptions. You want to get the medications, because we are only allowed to make prescriptions for the whole European Union. We have a 30% off of the best-selling book I have on testosterone, The Therapy for Real Gentlemen. I think I can say that this is the book that has the most information and also information. So if you want to do your own prostate examination, if you want to know what you can do to decrease prostate hypertrophy, if you can take testosterone, and when you have prostate cancer, it's possible, and it shows you the study, the references, and what the modalities are. It also shows you how testosterone improves your looks, but also your mood and all aspects. So it's really the most complete book, I think, with a lot of references. But what is mostly interesting is the information, how you as a man can really live your life as a man throughout, and you don't need to be just an old man that has no libido anymore or erectile dysfunction. You have all the information, erectile dysfunction, not only on testosterone, the melatonin and all the things like that. So you can make the best choices. So it's really, if there's a book, this is the code, Testo30, and you go on the website, hertogmedicalschool.eu.
Perfect. And we'll link to that in the show notes at muscleintelligence.com/podcast. And if you guys are watching on YouTube, hertogmedicalschool.eu, you can over there and pick this book up. I highly suggest it. As we say, you are the number one resource when it comes to everything hormone replacement. Dr. Hertoghe, thank you for being a guest.
Thank you, Ben. And to further with the good work, I think you're doing very good work. You're enlightening the people to go in the best direction, take good care of themselves. That's something that not enough people do, and they should do it, because how can you make other people happy if you're not happy and not in good health? So make other people happy by making yourself happy.
That's it. Thank you, sir. I appreciate you.
Bye-bye.
That's a wrap, ladies and gents. Thanks for being here. Ben Pakulski, Muscle Intelligence Podcast. There's a lot to download. There's a lot to dissect. If you do feel you got some value out of this, do share this with one person you know and love. My suggestion is you actually go back one more time and listen to this podcast again, because there's so much information. I've actually listened to 3 times now, because there's so much new information, so much valuable information, that this podcast is absolutely worth listening to again. I appreciate you being here. I appreciate you making the time to always support the Muscle Intelligence Podcast. I am truly committed every day of my life to supporting men and women around the world, and ultimately children, to be the highest and best version of ourselves. If you guys haven't heard, my message and my mission is really rooted in reconciling the family unit. I want men to show up as men and women to show up as women, or ultimately show up with the best version of yourself so you can show up with what matters most to you. And I want to ultimately support guys so we can be better leaders in our communities. And gents, I appreciate you. Have a great day, and we'll talk to you soon.
Thank you so much for tuning into Muscle Intelligence. If you enjoyed today's episode, please be sure to share it with at least one person you know. Make sure you're subscribed so you never miss an episode. This podcast is for information purposes only. The statements and views on this podcast are not medical advice. This podcast, including Ben Pakulski and the producers, disclaim responsibility for any possible adverse effects from the use of information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements or advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein. If you think you have a medical problem, consult a licensed physician.